There are many effective and safe methods to screen for colorectal cancer. Colorectal cancer screening works because it helps doctors identify and remove colon and rectal polyps before they have the chance to develop into cancer. The most common screening test is the screening colonoscopy. Colonoscopy is a procedure that is performed in a health facility under the care of a medical team. The day before the procedure, a strong laxative is taken to clear stool from the colon. On the day of the procedure, we give sedation or anesthesia so that you are comfortable. This allows us to use a long, flexible camera attached to a light source to examine the walls of the colon and rectum for polyps. Polyps are removed during the procedure to reduce the risk of developing colorectal cancer. Colonoscopy is performed every 3 to 10 years, depending on the findings. It's important to note that colonoscopy is not the only method of colorectal cancer screening. Another method is the fecal immunochemical test, or FIT, which must be completed annually to be effective. FIT is a stool-based test that you can do in your own home. We provide instructions for how to collect a small stool sample, which can be dropped off or mailed into the laboratory, where it is tested for small amounts of blood not visible to the human eye. Individuals with a positive or abnormal result, meaning that there is blood in the stool, require colonoscopy to identify the source of bleeding. But that's not it. Additional screening options include the stool DNA test, which is much like the FIT, but also examines the stool for DNA consistent with colorectal cancer. This test can be done at home and should be performed every 1 to 3 years. You may also opt for a virtual colonoscopy, which is a unique CT or CAT scan of the colon and rectum. The scan can detect polyps, which prompts colonoscopy. The high sensitivity fecal occult blood stool test and flexible sigmoidoscopy are less common but well-studied screening tests. Importantly, for all non-colonoscopy screening tests, a colonoscopy is required if the test result is abnormal, which is the case for 5 to 12% of people. Each of these tests discussed today accomplishes colorectal cancer screening. So consider the options and the test features that are most important to you. Remember, the best test is the test that gets done.